What we as physicians know well is that it's not only Zika that potentially poses that risk. This is something that we've known really for generations. There are many other infections that, if exposed to during pregnancy, can cause similar problems for that developing fetus or baby as they get older. Perhaps the most common of these is cytomegalovirus, or CMV, which is an infection that is really pretty common. It generally causes a fever and runny nose. Usually the symptomatic individuals with this virus are the young children, and very often a pregnant woman who is exposed to this by being around a child who's ill may not even ever know that she has been exposed until down the road her baby is born and is found to have some problems. Most commonly we see microcephaly, or a head that is too small, hearing loss, and abnormalities on imaging where these babies' brains have formed differently. For these children, these changes can actually be quite severe in terms of the impact of their life long term. They can have significant developmental delays, epilepsy, cerebral palsy, and so it's very much an infection that people need to be aware of. Perhaps a less common but easier to prevent infection is toxoplasmosis. This is a bacteria that's spread usually from cats. It's found in cat feces. Generally doesn't cause any symptoms to a mother, but because of the way that it is spread, is easily prevented. In that case, you can prevent some of these complications in baby, which are generally less severe, but again, involve developmental delay and sometimes some other symptoms as well. This is the perfect opportunity to think about all of those other infections, like the ones that we've talked about today, and to really educate our patients, to tell them not only about how to protect themselves from Zika by limiting travel to these regions of the world and protecting themselves from mosquitoes, but also to remind them that there are risks from other infections and exactly how they can modify their day-to-day lifestyle in easy ways to protect them and baby from all of these infectious diseases that are important during pregnancy.